Leadership Academy Foundations of Medical Education video series. Watch to learn what advice Dr. Marianna Worczak would give someone considering becoming GME faculty.
So my name is Marianna Worczak. I'm a family physician. I have been working in GME since early 2016. Spent about 9 years as a program director in upstate New York, and now I work for Tamarack Health as their founding program director for family medicine.
What was it like to engage with GME early in your career? What do you think are advantages or disadvantages to this timing?
I came to GME just under 3 years out of residency, knowing full well that I wanted to teach. Honestly, my experience as a chief resident had taught me that I really enjoy teaching. So I was really excited about it. But of course, there's a lot of fears that come with starting as a new faculty member. I was still early enough in my own clinical practice to have a lot of doubts about my own ability to take care of patients on my own, and kind of doubts in my knowledge and ability to mentor individuals. But I had a really great mentor. My former program director had asked me to come and help start a new program. And I found out really quickly that I did have a lot to offer and a lot to teach new interns, new residents, and also being a little bit closer to training gave me the perspective of understanding what training was like. And I think that really helped me to relate to the residents quite well. I actually also, so I came originally as a core faculty member for a new program, had plans to be, a faculty member, but had no plans to have a leadership role in the program. And then very quickly, our program director left our program unexpectedly, and I found myself in a position to kind of take the reins and keep going with it. And I was terrified at first. But again, I had a really great mentor, which I think is actually super important in either joining a faculty or in kind of moving along in your career. And within family medicine, there are a lot of ways to get some of that training that you need to be able to lead. For example, there's something called a NIPID fellowship, which trains you to be a program director. So I did that, and then I was able to take advantage of a bunch of the conferences offered for faculty development and for program development, like RLS and the ACGME educational conference. And that really put me in touch with other folks that either were new program directors or had been program directors for a while, and gave me the confidence in the community to kind of move forward. And I think it was a great step. It was putting myself out there, but I really have absolutely no regrets with kind of starting early and also taking that leap of faith to go down the leadership journey.
What are some of the barriers you faced as a new faculty member, and how did you overcome them?
Some of the barriers, I think, are perceptions. I think when folks are looking at a faculty role, some of the first thoughts that come to mind are, am I qualified enough? Do I have enough experience? Am I going to be a good teacher? What could I possibly teach, someone who's new to medicine? But I think that those feelings are very normal. And I even remember having mentors tell me that just for clinical practice alone, it takes a good 5 years at least into practice before you feel like you know what you're doing. So one, I would say just kind of telling yourself that and talking to other faculty members who have been new before, and kind of seeing what they felt like when they were starting. Two, remembering that if you've graduated from, a solid residency program, you have had good training, and you are actually very up to date on what the current guidelines and recommendations for patient care are, and that puts you in a great position to be teaching new residents. The other is that there is always support out there, and so if you don't feel like your teaching skills are up to speed, there are fantastic national programs, national conferences from STFM to AFP RLS to ACGME, and then lots of local and regional conferences. I know for me, when I first started, I was part of the University of Vermont's Health Network, and they had something called the Teaching Academy, and that was great to get a foundational experience. So I really encourage people to find ways to kind of get that foundational teaching in teaching, and just kind of approach it with humility, knowing that you're going to make mistakes, but you also have a lot to bring to the table. And if you have that kind of humble mindset, learners really appreciate that as well.
How did you build teaching skills and get good at teaching?
What I'll say to start with is that, I'm in family medicine, and really think any clinical specialty, just remember that you already do have some skills in teaching, because part of our jobs every day is to teach patients, right? Teach them about their illnesses. And so remembering that is helpful. There are lots of great resources out there, though, to formally teach you how to teach. You know, like I mentioned, there are national conferences you can go to. I think having mentors is kind of asking, like, for example, the first time you're precepting, sitting with somebody, have kind of shadow precepting, and kind of watching how they work with residents and students is really helpful. I think the other piece to keep in mind is that just like clinical medicine, teaching and learning how to be a good teacher is definitely a journey. In fact, the ACGME has milestones for educators for just that reason. But I mean, you can certainly start with your style. You can have some trial and error. Feedback is really important to learners, and so feedback goes both ways. So when I'm working with new faculty, we talk a lot about how to give feedback, but also how to receive feedback. And actually, one thing that we've in my former position, what I've done is had all new faculty and all new residents work through a book called "Thanks for the Feedback" to kind of learn about that process. And for me, that was really helpful.
What keeps you engaged as faculty, and what does teaching fulfill that clinical practice alone doesn't?
For me, it's hard to envision being in medicine and not having a teaching role, because it hits so many parts of my pleasure in being a physician, and also kind of my professional development. For one, what I found with teaching is it's a really great way to stay up to date. I can't tell you how many times I thought I was up to date, and then I had a resident or student come in and mention the latest guideline or something that changed, and I had to like pause and go back and read about it. It also, for me, make sure that I really understand what I'm doing, because there's nothing like breaking something down and trying to explain to a learner why you're doing something or how some part of the body works and having to teach it. And it's definitely, for me, shown where I've had gaps in my own knowledge. It really, like, again, promotes lifelong learning because you're constantly reviewing subjects so that you can teach them to others. And then you're also kind of already exposed to lectures and case studies and case reviews and all those things that kind of keep your mind fresh. There's also I get a ton of fulfillment personally in watching folks grow. I think some of my favorite things, two favorite things is to see over my years as a clinical educator is one, seeing docs in the community where I train them, and even having friends or family members come and say, "Oh, I saw Dr. So and so. They said you were, part of their growth and how they became a doctor," and that's pretty neat. And the other is the learner that's struggling. So sometimes struggling learners can be very frustrating and really challenging. But when you watch a struggling learner like finally get it and be successful and graduate, and then later on see them in the community or wherever they practice, that's super rewarding. So I think teaching, being a faculty member and being a program director has been super rewarding for me for all those reasons. But it allows me to be a doctor, but also to have this whole other wonderful aspect to my day-to-day and to kind of my legacy in medicine.
What advice would you give someone considering becoming a GME faculty?
I would say if you enjoy teaching at all, that includes even just teaching your patients, I would say go for it. You might feel really nervous. You might feel like you don't have enough to offer, you're not prepared, or you don't know how to teach. And I don't think any of that's true. I think that everyone in medicine who's been seeing patients does have some teaching skills. And I also say there's lots of ways that you can learn and develop those teaching skills. I would also say to, really think about getting a mentor and finding those people that you really think are good teachers and kind of observing their styles or asking questions and asking for help for the other aspects of academic medicine, like scholarship and that sort of thing that you may need help with. The other thing I'd always say is if you're new to GME or you're fresh out of residency, you might have a really fresh perspective for a faculty body. And so, residency programs need folks that have tons of experience and also folks that are new and kind of closer to training. So it provides a really nice balance. And finally, I would say that one of the great things about being a faculty member is it can be very flexible, and it can allow you to do things that you can't always fit into full-time clinical practice. For example, if there's a skill or a niche within medicine you really enjoy, you might become kind of the expert in your program in that niche. If you want to do more scholarly activity and present at conferences or write papers, it gives you that opportunity. And it also gives you the opportunity sometimes to travel and to network with other educators, which can be really fun and really prevent burnout. So I would say go for it for all those reasons.
Leadership Academy Foundations of Medical Education video series.